I've been active all my life, played a number of sports, and basically if I wanted to do something, I got up and did it. And that all started to change about 3 years ago. My name is David Smith, and I'm a former patient of BGH. I had both my hips replaced. Well, it was May of 2015. I just one day started to experience some pain and discomfort in both my hips. And at the time I thought it was just normal aches and pains, something that would come and go. And it didn't. And it gradually worsened throughout the summer and didn't get better. I remember playing around the golf, and by the last few holes I could hardly walk. And that was probably when I decided I should go see my family doctor. Prior to my surgeries, just being able to walk became very difficult, and I actually was, in some cases, was using a cane to get around. I met Dr. Quam through a referral from my family doctor, and he assured me that Belleville had a number of very well qualified and experienced surgeons, and I was fine with that.
First time I met David, I saw him in the office in consultation. He's a 61-year-old gentleman who came in complaining of pain in both of his hips that had been going on for the last 6 to 12 months. And he was there to see what his options were. So at the time he came, his x-rays showed that he had significant arthritis in both of his hips, which it was the cause of the pain and dysfunction that he was complaining of at the time. The cartilage is like the Teflon on the frying pan that allows the joint to glide. And in this case, in David's case here, the Teflon's all worn off, the cartilage is gone, and he's down to bone on bone, which causes pain, stiffness, and significant dysfunction. If he didn't have the surgery, likely ongoing pain and reducing functionality, quality of life. People, including David, with hip arthritis, have difficulty doing everyday activities, such as simply walking, getting in and out of chairs, going up and down stairs, reaching their foot to put their shoe and sock on, and even sleeping at night. And to perform the procedure itself, we require basically power tools, similar to what you'd see at your neighborhood hardware store, including saws and drills. Here at Quinte Healthcare, we do about 840 hip and knee replacements a year, and then several hundred more trauma procedures, all of which would use this type of equipment. But certainly the demand is ever increasing, especially in our area, in the Quinte area. The population is aging, and this tends to be the type of surgery that's done in the older population group. This type of surgery restores function, allows them to return to their activities, and eliminates the pain.
It restores your normal everyday life. Two years later, it's all back to normal. I can do pretty much what I want to do. So it's a life-changing event to have the surgery and go from being somewhat disabled to living an everyday life again, normal everyday life. My entire experience, from Dr. Quam and his staff in his office, to the people in the OR, to the hospital staff, the PSWs and the nursing group, were just nothing but positive. And I would like to note that within about 3 days of both my surgeries, I stopped taking medication, and I haven't taken any since. So I'm pain-free, medication-free, and back to doing normal everyday activities. There's not much that I can't do. I've seen the impact that donors have. The hospital needs our financial help. I've donated to support orthopedic equipment and renovation of the fracture clinic. I hope others will too.